there are at least two important strategies of combining anti-angiogenics with other drugs, excluding chemotherapy. The first one, I think that is in EGFR-mutated patients, because in this case, we achieved the great results of the combination of erlotinib and bevacizumab, and we are waiting for the final results. But I know that there are also ongoing trials with erlotinib and ramucirumab in the same setting in a trial called Relay. And there is another field in which, in my opinion, it is worth to investigate, and this is the field of combining angiogenics to immunotherapy. There are several hypotheses and rational ideas on combining them. One is that anti-angiogenics can increase the permeability of the vessels, and this can allow the T cells to reach the tumor. The other possibility is that the anti-angiogenics can enhance the expression of the antigens on the dendritic cells, and so allowing more activity of also immunotherapy. So I think that also in this film we have to work a lot, because it is possible that the two strategies are synergistic.
Well, the field of anti-angiogenic agents is sort of slow right now. I don't see too many new agents coming forward. You know, at one time this was all the rage, you know, targeting the blood vessels and preventing tumor growth. I think their greatest utility now of bevacizumab and ramucirumab and other agents is going to be how they modify the microenvironment and how it affects immune function and infiltration of T cells, the so-called TIL, tumor-infiltrating lymphocytes, and how it affects the flow of blood into the tumor and the migration of macrophages and other important constituents of the immune response. So that's where I would see things going. I don't see these agents moving into the front line unless they're in the front line with immunotherapy.
Yes, there is a rationale to combine anti-angiogenic agents plus immunotherapy. There are some studies suggesting that targeted agents may induce some immune effect in cancer, and there are other preclinical studies showing synergy between anti-angiogenic drugs and immunotherapy, immunocheckpoint inhibitors, mainly anti-PD-1 and anti-PD-L1 strategies. Are ongoing studies, we have ongoing studies, so there are phase 1 trials analyzing the combination of ramucirumab plus pembrolizumab, and there is also another phase 1 trial analyzing the combination of atezolizumab plus bevacizumab. So in lung cancer, there is a clear rationale to combine an anti-angiogenic drug plus an anti-PD-1 or anti-PD-L1 compound. There are some studies showing synergy between the two strategies, and we have also the studies showing that targeted agents induce immune effects in cancer cells. There are ongoing studies. We will see the results of a combination of ramucirumab plus pembrolizumab and also the combination of atezolizumab plus bevacizumab.